living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
It's often called one of the most important organs and serves as the hub for controlling and coordinating the body's functions. We're talking about the brain this morning and how it changes with age, how medications can impact the way it functions, and common problems and diseases that affect it as we get older. I'm your host, Beth Brown. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. We'll be right back after this. Stay with us. Welcome back. Our first guest is Diana Lurie from the University of Montana, who is here with us today to talk about some brain basics and what can commonly happen to the brain as we get older. Thanks so much for being here today, Diana.
It's a pleasure being here.
Can you just start out a little bit by just saying what you do at the University of Montana and what your specialty is?
Sure. I am a professor in the School of Pharmacy at the University of Montana, and so I teach anatomy and physiology to pharmacy students. I am a neuroscientist, so I've spent my life studying the brain.
Awesome.
I also do a lot of integrative medicine and traditional systems of medicine. And my research lab looks at inflammation in the brain and how that affects our functions after injury, after depression, anxiety.
Okay, great. So can you give us just a basic overview of what it is the brain does and how it does control a lot of our functions?
Exactly. So the brain is really our interface between the outside world and our internal world. So the brain takes all the signals in your external world, what you hear, what you see, what you touch, and it interprets that information and allows you to move your muscles so that you can navigate through the world. The other thing that the brain does is it monitors your internal world. So it's taking care of your heart rate, your respiration, your digestion, all the things that you don't think about on a daily basis but happen in your body. So it's the master regulator.
Okay, great. And as we age, our brain changes, and some of that is normal, right? Can you just talk about what can be expected or what's common as we age?
Absolutely. So as we age, our brain begins to shrink a little bit, and we begin to lose some of our memory a little bit. You know, we might forget where we put something, or you have to keep lists to remember everything. And that's perfectly normal. That's just normal aging.
Okay. And I know a term that people have heard a lot, cognitive decline. What exactly does that mean?
Yeah, so cognitive decline means that the general function of your brain isn't quite as sharp as it was when you were, say, in your 20s. So you might have some issues with memory. It might take you longer to perform everyday tasks. You might forget words. Just small little changes in general, just kind of slowing down the functions of your thinking.
Okay, so that phrase doesn't have to be scary. It's
not
pretty
at
common.
all,
Okay.
not at all.
Okay, perfect. And is there a certain age when people can start to expect to see some of that cognitive decline, or is it different for everyone?
That's an excellent question. And that gets to the point of we have two ways that we think about time. So time is chronological, the minutes, the hours, the days. And then there's biological time, which is how your body actually ages. So everybody's biological aging is going to be a little bit different. But in general, we start to begin to see some of these maybe memory issues, some of this cognitive decline around the age of 40.
Okay. And you mentioned that the brain shrinks.
Yes.
Why does that happen?
It happens because the cells get tired, they get old, and some of them begin to die. So we have two types of cells in our brain. We have our cell bodies, that is composed of what we call gray matter. And then we have the processes that those cells use to communicate with each other. And they're like roadways through the brain, and those are called white matter. So you've got clusters of cell bodies, and then you have pathways that information flows around. And both those clusters of cell bodies and those pathways begin to shrink around the age of 40.
Okay. And so is that tied to cognitive decline then, or is there different factors at play there?
No, that's definitely tied. That's one of the factors in cognitive decline, that your brain is shrinking a little bit. You also have chemicals in your brain called neurotransmitter that your brain cells use to communicate with each other. And we see a decrease in those levels of those chemicals that the brain cells use to communicate with each other. So you have kind of a physical decrease, and then you have a chemical decrease in your neurotransmitters.
Okay, and part of that you mentioned earlier is memory loss. We have to start writing some things down. How normal is it to experience some memory loss, and is it okay or something to be concerned about?
You know, we all experience memory loss as we age, and that's perfectly normal. It's perfectly part of the aging process. You have to start being concerned about it when it really begins to interfere with your activities of daily living. So your work or your social life, if it really gets to the point where it's interfering in a large way with your life, then that's something to address.
And can you talk a little bit about the physiology behind that too? What is exactly happening in your brain that makes you start to forget things?
Well, that is related to the shrinkage that we see in the brain. And we have an area of the brain called the hippocampus, which is part of our memory. It helps to consolidate memories, it helps us retrieve memories. And that is one of the areas of the brain in particular that shrinks during aging. So not the whole brain doesn't shrink, but regions of it do. Okay. So the hippocampus shrinks, the front of the brain, the forebrain shrinks also, and that has to do with our decision making. But interestingly, the back of the brain, where we code our visual information, that doesn't get touched at all, that stays fine. Okay, so that's why we see changes in memory, but not in some of the other functions of the brain. Okay,
exactly. Perfect. So we're going to pause there. We do need to take a quick break, but Diana is going to stick around to talk about some common problems and diseases that happen to our brains when we age. Stay tuned. We'll be right back after these messages. Welcome back. We're here with Diana Lurie from the University of Montana, continuing our discussion about our brains and what happens to them as we get older. So Diana, thanks for sticking around with us.
Oh, great.
So we talked already a little bit about memory loss and that some of that is normal, but at what point does it become a concern?
It becomes a concern, as I said earlier, when it really interferes with your activities of daily living. So if you keep asking the same question over and over again, if you repeat questions, if you are in a familiar environment and you get lost, so say you're going down to the grocery store and then all of a sudden you don't understand where you are, you feel lost. If you substitute words a lot, so you say table instead of bed, those are all indications that maybe you should go see your physician and get tested.
And we know that one disease that may be what is going on there is dementia. There are many different kinds of dementia, but can you start out by just talking a little bit about generally what dementia is and give a breakdown of what those effects are?
So dementia is kind of an umbrella term for basically for some degeneration in the brain, and it manifests itself in different symptoms. So memory loss is one of the more prominent symptoms of dementia. Not being able to think properly is another one. So an example of that might be you would have difficulty calculating the tip on a receipt. You might have difficulty following a recipe.
Okay.
So those are all sort of indications that there might be something abnormal going on in the brain.
Can you explain why dementia happens?
Well, it happens for the same reason that cognitive decline happens. It happens largely because you get cell loss and the brain begins to shrink. And there are some factors that can contribute to potentially risk factors for dementia. So things like depression is a risk factor. Cardiovascular disease that's not treated is a risk factor because you've got blood vessels going through the brain. And if the blood vessels get less flexible, the blood pressure goes up in the brain and you have a risk for stroke. Interestingly, being obese is a risk factor for dementia. Having a lot of adipose tissue, it seems to be correlated with dementia.
Okay. What about genetics?
Absolutely, there is genetics. There are genetic predispositions for different types of dementia, like the dementia that you see in Alzheimer's disease. That has a genetic component for it. And we basically think about dementia as being a combination of your genetics and then your environment. So both of those play a role in whether you develop dementia or not.
So can anyone get dementia, or do those risk factors need to be there?
Well, old age is the biggest risk factor for dementia. And so if you live long enough, pretty much everyone's going to get dementia because you're going to get that shrinkage in the brain.
Okay.
So
wow.
again, it's very individualized for each person. Their genetics, their physiology, the environment that they're in really play a role in the development of the disease.
So how does a person know, or maybe a loved one know, if someone has dementia?
If they notice some of the things that we just talked about, repeating questions a lot, repeating conversations a lot, getting lost in environment that they're familiar with, not being able to follow a conversation or follow instructions.
Okay. Can you cure dementia?
Oh, that would be great if we could. But unfortunately, we don't have any way to cure dementia. It's part of the natural aging biological process. We have some strategies that might slow down dementia and might help prevent dementia. There are some drugs like Aricept which can reverse the symptoms for a little while, but it's not permanent.
Okay.
Yeah.
So let's switch gears and talk about some other diseases that people, or conditions that can happen with brains. What about seizures? Can you talk about what those are and how they can happen?
Yeah, so seizures are what happens during epilepsy. So what seizures are uncontrolled electrical activity in the brain. And it can be in different parts of the brain. So the symptoms of seizures can be different. Some people become unconscious. Some people can have muscle spasms. If they're small seizures, sometimes you can just get movement, eye movements.
Okay.
So there's a whole different variety of symptoms that can happen with seizures.
And what about stroke? That's also something that can affect the brain. Can you talk a little bit about what happens when someone has a stroke?
Absolutely. So stroke basically means that the blood supply to the brain is interrupted. And in order for the cells of the brain to work correctly, they have to have oxygen and they have to have glucose. And they get oxygen and glucose through the blood supply. So when you have a stroke, that blood flowing through the vessels in the brain gets interrupted. And there are two types of strokes. We can have an ischemic stroke where there's a blockage in that vessel. And so the blood can't go through and the tissue around the brain tissue dies. The other type of stroke is what we call a hemorrhagic stroke, when the blood vessel bursts. It might have a thinning in the vessel wall and the vessel bursts and blood floods in the brain, and then you don't get the proper flow through with glucose and oxygen.
And what are the effects that can happen to a person if they've had a stroke?
It really depends where the stroke is. Okay. So if the stroke is in an area that controls your muscle movements, it's very common for somebody to have paralysis, maybe in an arm or a leg or on one side of the body. Sometimes people have trouble with speech. If it's in an area that controls your heart rate and respiration, it can be fatal. It really just depends where it is.
Okay, so we're almost out of time, but are there some other common diseases that folks should know about that could impact the brain, one or two?
Yeah, absolutely. Concussion is one, and there's been a lot of discussion about that recently with the NFL.
Sure.
And migraine headaches affect the brain, and they largely affect the blood vessels that are in the brain.
And just really quickly, what exactly is a migraine?
A migraine is a very severe headache that tends to be localized. Some people get an aura before they get a migraine, so they might hear something, or sometimes they see a halo around objects.
Okay, perfect. So things to be on the lookout for.
Yeah.
All right, thank you so much, Diana, for being with us and sharing that great information. Coming up next, we'll talk about what medications you may have in your medicine cabinet that could be taking a toll on your brain health. We'll be right back after these messages. Welcome back. Joining me now is Lisa Sather to talk about how some medications can impact how our brains function. Lisa, thanks for being with us today.
Thank you, Beth.
So the effects of certain drugs are different on older people than they are on younger people. Can you start out by explaining why that is a thing?
Yes, sure. It's really interesting. Older folks are actually more than twice as susceptible to the effects and actually side effects of medications as younger folks. And there's really several reasons for that. Generally speaking, I think it's important to note that for drugs to work in our body, they actually have to first be absorbed into our bodies through our intestine. They're then distributed throughout our body, eventually metabolized, broken down, and then eliminated from our bodies. And as we age, things change with that. So, specifically, as we get older, there tends to be more body fat we put on. We tend to have less water composition in our body. So drugs actually are either distributed in fat or distributed in water. They've got to dissolve one of those two ways. So as we age and we have more body fat, there's actually the chance to accumulate drugs that are stored in fat, so they may build up. And then those drugs which have to be dissolved in water may tend to be more concentrated because there's less water in our body for them to be distributed within. So that's a couple of the things. Also, as we age, our kidney function just generally declines over time. That is a natural part of the aging process. Our liver function may decline a little bit as well. Sometimes our stomachs don't work as they normally do. We might have more acid production, and acid is also a contributing factor to how some drugs are broken down. So just overall speaking, there's all these things that come together to contribute to why, as we get older, drugs may work differently. Folks may end up getting drugs built up in their system because of all those things that I just mentioned to you. And that's why actually there are situations in which we can reduce the doses of drugs in older folks and still get the same therapeutic effect as we would if we had a higher dose, because they're just not eliminating them as normally as they would as a younger person might do.
Okay, so let's talk about some common medications that folks might take, and let's start with over-the-counter sleep aids. What is in that kind of medication, and what is that doing or could potentially do to a brain?
Yeah, that's a great question. So over-the-counter, meaning available without a prescription, sleep aids are commonly used and sometimes purchased by folks in order to help them fall asleep at night. The most common component of an over-the-counter sleep medicine is first, what we call a first-generation antihistamine, such as diphenhydramine, and you've probably heard of that as the brand name Benadryl. Also, we may see over-the-counter sleep preparations be in combination with some pain relievers, such as Tylenol. So that's basically Benadryl, or the Tylenol PM that you've heard of is Benadryl plus Tylenol. And basically antihistamines are normally used by folks for treating allergies, as we know. But one of the side effects of antihistamines is drowsiness and sedation. So that basically is why they're used for sleep medicines. The unfortunate thing with some of these medicines is they can cause slowing down, a little bit of the brain, and so we'll get into that, I guess, too.
Well, yeah, that was that was going to be my next question. So that's what it does. It slows down the brain.
That's exactly right. In addition to the antihistamine effects, which is what we use them for allergies for, they do cause slowing down of the impulses in the brain, and that is in effect what makes us sleepy and tired. Now, I think it's really interesting. I had just read this recently, that a single effective dose of diphenhydramine, for example, can cause driving impairment similar to having a blood alcohol content of 0.10,
wow,
which is higher than the legal limit in most states of 0.08. So I think that's really interesting. Important also to note with these medicines, they can cause problems with memory, confusion, and those kinds of things. So it's something we just really want to watch out for and typically avoid in older folks.
Okay, so let's switch and talk about some prescription drugs. So benzodiazepines, they're a class of medications that are sometimes prescribed for sleep, but also maybe anxiety or depression, seizures. What effects do these medications have on a person's brain?
Yes, so these medicines are going to work similarly kind of to what we've talked about with the antihistamines. They cause dampening of some of those effects, some of those chemical messengers in the brain, which is why it can be effective for seizures. But also, in addition, for For sleep, they're used to kind of calm people down. And also some folks may have had experience using these in terms of pre-medication for anesthesia prior to procedures, because they actually can cause a little bit of amnesia. We kind of forget what has happened. And so that is what they're used for in that respect.
So benzodiazepine, that might not be a term that everybody is very familiar with. What would commonly be referred to as these medications, or what might people have heard that called?
So, some of the most common ones that we see are alprazolam, which is a generic name for Xanax, clonazepam, which is a generic name for Klonopin, diazepam, which is a generic name for Valium, and temazepam, which is a generic name for Restoril, and they all end in PAM, so that's a kind of an easy way to remember what those are.
Okay, and then some of the common sleep aids that folks might know, like Ambien, Lunesta. Can you talk a little bit about what those do to the brain?
Yes, absolutely. So these we affectionately call the Z drugs, because they either start with Z, the generic name, Zolpidem, Zaloplan, or Clopazone, or have a Z in them. So that's just kind of one of those things you might have heard. And they work similarly to the benzodiazepine. They are structurally different, but chemically are working the very same way. So I think one of the things important to note with these drugs, side effect wise, is that they can cause also some amnesia-like symptoms, and folks may actually end up doing things in their sleep that they forget they're doing, like sleep driving or sleep eating.
Okay, and we're almost out of time, but just really quickly, Lisa, are there alternatives that people can use rather than going to their medicine cabinet?
Yes, great question. So sleep. Really important to do appropriate sleep hygiene, where you do the same routine every night, avoid stimulants before bed, and all those kinds of things. People can check that out, Google that, and find out what the appropriate use of that is. And then also melatonin may be a helpful agent for some folks to help them reestablish sleep patterns.
Perfect. Thank you so much for your time.
Absolutely.
I'd like to thank Diana and Lisa for being on our show today. We've talked about some of the brain's natural aging and some things to be on the lookout for when it comes to your brain's health. Tune in next week when we'll talk about how you can keep your brain sharp and young with diet, exercise, and even being around your friends and family. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.